Good afternoon. National Assembly for Wales is now in session, and the first item this afternoon is questions to the First Minister. And question one is Darren Miller.
Thank you, Presiding Officer. Will the First Minister make a statement on the future of the NHS in Wales, please?
Yes, the Welsh NHS is one of our top priorities. That's why we're investing more than ever in our health service.
Thanks for that answer, First Minister. One of the first things which a future Welsh Government will have to address are some of the challenges in our out-of-hours care in the health service. And you will note the report which has been published today by the Public Services Ombudsman, which has shown examples of patients coming to harm as a result of shortcomings in out-of-hours care. And of course it comes hot on the heels of a report by the Public Accounts Committee which expressed concerns about GP out-of-hours care in North Wales, which explained very clearly that around 77% of rotas are covered in some parts of Wales, which leaves 23% obviously without GP cover. What action are you taking specifically to address those problems in North Wales in terms of GP out-of-hours care?
Well, we're working with both the Royal College and indeed the BMA to address those issues. There are 112 GP practices in the north of Wales. 4 of them have served notice that they're not able to fulfil their contracts. What then happens is that the local health board seeks to work with those practices. If that's not possible, then other practices are able to take over the practices that no longer exist, and beyond that, of course, the LHB will take control of the situation itself to ensure that the service continues for people in a manner that they would expect.
Eagle.
The Welsh Conservatives' proposal for scores on the doors to rank Welsh hospitals is the clearest indication yet that they will follow the trail blazed by David Cameron and Jeremy Hunt of restructuring and privatisation from the top. Yes. Would you agree with me, First Minister, that the future of the NHS in Wales is dependent not on treating patients as customers or to shop around or creating internal markets, but in the spirit of cooperation and investment we have created to ensure that all hospitals can provide high-quality services?
Absolutely. I mean, I don't think that the challenges the NHS faces can be answered by way of a sticker on the door. No, that seems to be the simplistic answer. It's not particularly ambitious because we look at the My Health Online website. There are far more indicators that the public can access in order to see how their local hospital is doing. I notice as well that the Welsh Conservatives are not going to apply this to mental health, to GPs, to dentists. Well, why not? Would be the answer. Would be the question that I'm sure the public would ask. From our perspective, we have a system that is far more comprehensive.
You had your opportunity. You've tried 5 times from the seated position. Stop. Have you finished, First Minister?
We have a system that's far more comprehensive than what's being proposed by the Welsh Conservatives.
Thank you. Clear Griffith.
Thank you, Presiding Officer. The spirit of collaboration and investment that Lynn Eagle mentioned, of course, has led to a situation in North Wales where the Bettigorrah Health Board has had to spend £3.2 million in 1 month on agency staff. Now, what does that tell us, in your view, on the condition of the capacity of staffing of health services in North Wales?
Well, the health service has always depended on some agency staff, and sometimes when staff are sick, we have to ensure that there is a temporary service available for the patients. It's not something that is a permanent fixture, but as the majority of staff in the NHS are permanently employed by the NHS themselves.
Alan Roberts.
Thank you, Presiding Officer. First Minister, one of the things that concerns the people of North Wales most is waiting times. In July 2014, your minister said about waiting times in North Wales.
Cadwaladr is currently unable to provide treatment within the 26 and 36-week periods that we laid down. My officials are working very closely with it to ensure that it is in a position to do that in the future.
Are you therefore concerned that the Bettigorrah Health Board has asked for local variation with hospitals in England who state that they will only be treated within 52 weeks? And if you go to Gobowen Hospital, for example, if you are from Hywel Dda and Powys, the agreement between Gobowen Hospital and those health boards is that they should be treated within 40 months. If you live in North Wales, it's 40 weeks rather than 40 months, and it's 52 if you live in North Wales.
Well, it's up to any health board, of course, to ensure that they work within the targets as regards the waiting times. And, of course, we expect the English hospitals to ensure that treatment is available for people from Wales. And, of course, it's true vice versa, because it's the Welsh health boards that pays for the treatment that people receive in England. We know that the waiting times are reducing. The times people are waiting for treatment, for diagnostic tests. And that, of course, demonstrates that the funding that we've invested in the health service, which is 48% of the Welsh Government budget, is bearing fruit.
Minister, the Association of Directors of Adult Social Services state that in England, since 2010, the Tories have cut £4.6 billion from adult social care, a 31% reduction, which has led to devastating consequences in accident and emergency. Are you able to confirm that the Welsh Government, a Welsh Labour government, will not go down the road that the Tories would do if they were in power here?
Really not. The problem is that the Tories like to pretend that social care and health are two areas that are not related in any way whatsoever. They are. We know that if social care is not available, that has an effect on delayed transfers of care, which are rocketing in England. Why? Because money has been siphoned out of social care in England, and we know the effect that has on older people. They've given up, effectively, on funding social care and said to councils, it's all up to you now, which means that a council in a poorer area will find it more difficult to fund social services and social care than a council in a richer area. It's an abdication of responsibility by a Tory government in London, and they would do exactly the same if that happened in Wales. The people of Wales want to make sure that the vulnerable people are looked after. The Welsh Tories would abandon them.
Question 2, Mohammed Ashkar.
Thank you, Madam Presiding Officer. Will the First Minister make a statement on ambulance response time in the Naib Bevan University Health Board area, please?
Yes, the latest published figures for January show that the response time performance in the Aneurin Bevan Health Board area was among the best in Wales. 70.2% of red calls received an emergency response within 8 minutes, and over a third of calls received a response in just 5 minutes.
Thank you for the reply, Minister. But I was recently contacted by a family of an 80-year-old lady who lives in my constituency or region. This lady was found by her grandson lying on the floor of her bedroom at 4:20 in the afternoon. She was still in a night dress, so clearly she had fallen the night before. A paramedic arrived 20 minutes later and said she could not be moved because of her severe pain she was in. An ambulance was called, which took 3 hours and 20 minutes to arrive. Does the First Minister think it is acceptable that under his government, an 80-year-old lady should be left in severe pain for over 3 hours waiting for an ambulance?
Well, it's very difficult to comment, not knowing the full circumstances surrounding the individual. We know that the red calls are designed for emergencies. I appreciate what the member said about the lady being in pain. No one would want to see that. But a judgment is made by paramedics on the scene as to the severity of the person's condition. Where somebody is an emergency, where they are categorised as red, then we see, of course, that Aneurin Bevan has very good and improving figures in terms of ambulance call-out times.
We now move to questions from the party leaders. First this afternoon, Leader of the Opposition, Andrew Arty-Davies.
Thank you very much, Presiding Officer. First Minister, today we've had the report from the Public Service Ombudsman and the findings that he's had when he's looked at 12 specific cases over a period of time. And he's clearly called for an independent inquiry into out-of-hours provision, and in particular the help and support that can be put in place for junior doctors. I have, over this 5-year term, called time after time to you for a Keogh-style inquiry into the Welsh NHS. This is a growing bank of evidence that's come forward again today. Will you now, in the twilight hours of your government in this Assembly term, commission such an independent inquiry that can celebrate the good practice that is in many quarters of our NHS, but also identify the areas of concern that need support and put the packages of support in place so junior doctors and other staff members do not feel they're left isolated without supervision?
You've got to admire his brass neck to talk about junior doctors. I mean, you really have to. Tomorrow, junior doctors are on strike under the Tories in England for 48 hours. I mean, that's what they would do in Wales, import the junior doctor strike, and he stands up and talks about working with junior doctors. He doesn't know the meaning of the word. I mean, he raises the issue of the Ombudsman's report. Yes, of course, we take that seriously. I know that the Minister has already requested the National Clinical Lead for Unscheduled Care to give his assessment and provide advice on how best to learn from these individual cases. It's also fair to say, in terms of background, that 12 people have been identified. There were 3 million admissions in the period that was described. One of the people of that 12, that case occurred in the last 3 years, and we have introduced a range of measures to improve care, which are not covered in the report itself. But that said, the report we take, of course, seriously, and I've already described what the actions the Minister is taking. But we don't need his junior doctor strike in Wales.
First Minister, you say I've got the brass neck. This report clearly identifies premature deaths because people sadly were not getting the help and support they required from the consultant-led teams that should have been in place supporting the junior doctors in some of the decisions they're making. I make no apologies for making sure that we root out poor practice where it is and make sure we minimise the number of premature deaths within the NHS in Wales and in any other part of the United Kingdom. But again, you decline the opportunity to instigate an independent inquiry that could potentially look into these areas. So if it's a no from you, the electorate can make up their mind in the current election campaign that will come on May the 5th. However, First Minister, if we move on to a different area of questioning, well, a no's a no. Ultimately, First Minister, one of the key infrastructure projects you've identified as needing to be delivered to help the Welsh economy is the M4 Relief Road. Time and time again, you have stood there and said it is a critical part of the infrastructure to develop a 21st century economy here in Wales. Will you make sure that you, like us, the Welsh Conservatives, commit to delivering the M4 Relief Road in the next Assembly term?
Yes, and let's just come back to the issue that he raised earlier, he's trying to run away from. And that is what he avoids, which is the fact that if he had been anywhere near, to use his phrase last week, God help us, power in Wales, we'd have had a junior doctor strike in Wales. There is nothing worse in terms of care, in terms of premature deaths and having a situation where doctors are not in hospitals. And that's exactly what his government in London has delivered for the people of England, and we will not allow that to happen in Wales.
With the greatest respect, First Minister, mortality rates are higher in Wales than they are in England. It is a clear identifiable strand that there are greater number of premature deaths on the weekend than there are in the working week. If you want to stand by and allow that to continue, that's your prerogative. Have that discussion with relatives who've lost loved ones in hospital. Have that discussion with medics who've been put in the unenviable position of not having the support that they require when they're on call, on the weekend and out of hours position. You've time and time again refused to support that independent inquiry. Another point that I've raised with you time and time again that would help A&E provision would be to put consultants on the wards to make sure that there is consultant cover. The Royal College of Emergency Medicine have identified a staffing level that is required for consultants. If you take the FOIs that we've received as Welsh Conservatives, well, I appreciate it might be boring for the Labour Party, but premature deaths are an important issue.
Andrew Archie-Davies, don't address the members. Please ask the question.
The Royal College of Emergency Medicine have a clear bench line of staffing that is required in A&E departments. When you look at Howell Dda, their numbers are 15% of that bench line. When you look at health boards across Wales, they are not meeting their staffing requirement. What action are you going to take to make sure that you do get consultants in place to support junior doctors in A&E departments to make sure that we get on top of this situation?
Well, let me say to the leader of the opposition,
we don't really need your personal comments, thank you. First Minister is perfectly capable of answering. First Minister.
The NHS depends on senior doctors, it depends on junior doctors, it depends on nurses. We've seen what's happened to nurse numbers in England, what's being suggested for the nurse bursaries. We've seen the fact that the UK government's approach to working with the medical profession is to abuse them to the extent that they go out on strike. Now, if the Leader of the Opposition had actually turned around and condemned what his party has done in England, I would have more respect for him and the position that he has taken. But the reality is that we have a situation in Wales where we work with the medical profession and with the nursing profession. We do not work against them. We do not provoke them to go out on strike. And he only has to see the response of the medical profession in England, who say that morale is low, that many junior doctors want to leave England. They will be welcome in Wales. They want to come to a system where we spend more per head on health than England does, spend more on mental health, do better on cancer. Yes, recognise challenges, not everything's perfect, we accept that. But we don't have lots of trusts that are in special measures. We don't have a £2 billion deficit in the NHS, which is what his party have delivered in England. We will have in Wales an NHS that is free at the point of delivery, free from privatisation, an NHS that is well funded and not Cameron's chaos that exists in England.
Obviously enjoyed that. Now we move to the leader of the Welsh Liberal Democrats, Kirsty Williams.
Thank you, Presiding Officer. First Minister, you are correct to say that the Tories have declared war on junior doctors in England. Applications from English doctors to work abroad surged by 1,000% on the day that Jeremy Hunt announced his new junior doctor contract. And we do need to take advantage of that, getting those medics to come and practice their medicine here in Wales. But if we're to be successful, we need to assure junior doctors that there will be adequate supervision and support and training opportunities for them here in Wales. So could you outline clearly what steps you will take in response to the Ombudsman's report to ensure that junior doctors in Wales will be assured of adequate cover, supervision and training?
Well, it is something that, as I said, the Minister has asked the clinical lead to look at. We want to see what the clinical lead's view is. As I say, we take the report seriously, and there are cases that are mentioned in the report that deserve fuller investigation. We accept that. But as I say, against the context of 12 cases out of 3 million admissions in 5 years, one case, I think, mentioned in the report is from the last 3 years. We have put steps in place, and that mentioned in the report itself, since 2012 to deal with some of the issues that were raised there. So, yes, the 12 cases are concerning, of course they are, but it's not evidence of a systemic failure in the system. That said, of course, we wait to see what the clinical lead says.
Thank you for that. I believe that this Ombudsman's report, and he is perfectly entitled to, of course, and it's his duty to carry out such thematic reports, but I believe this is evidence that we do need wholesale change in the way we inspect our health services, and an important element of that would be to establish a new health watchdog that is completely independent of Welsh Government and that is properly resourced and able to do its job without fear of repercussions. Would you commit yourself to establishing a standalone healthcare inspectorate system here in Wales, independent of your government, who could investigate such matters as identified by the Ombudsman?
I agree with in principle. I mean, I wouldn't agree with it that somehow the inspectorate is leaned on in any way or isn't able to deliver a judgment that it feels is fit, but perception is important, and these are certainly issues which we are keen to look at in the course of the next Assembly. In terms of what's happened since 2012, if I could just inform the Assembly that we, for example, are the only nation to routinely review all deaths in hospitals. We've implemented a national early warning system to identify deteriorating patients at all times, and there have been significant improvements in sepsis and stroke care and outcomes. That's been put in place before this report actually came out, but I take the point that the leader of the Liberal Democrats makes about the need to look carefully at the perception of independence of the inspectorates.
Of course, when the inspectorate was set up, we didn't have the legislative powers we do now. But if it's good enough to have an independent inspector for education, I'm sure you would agree with me, it's equally important to have that in the field of healthcare. Now, the Ombudsman says today the cases highlighted do not appear to be isolated incidents, and an independent systematic review would confirm any emerging patterns or inconsistency in quality of care. Now, I'm sure you would agree with me that in order to learn the lessons from this report, and indeed many of the strategic challenges facing our NHS in Wales into the future, it's time to put patients, not politics, first. Will you recommit this afternoon, recommit to supporting our idea of a cross-party commission to look into the future of our NHS that can look at these issues around staffing and how we can continue to develop a quality care environment for all Welsh patients?
Well, we agreed, of course. Yes. It was the other parties that wouldn't agree. I mean, yes, in an ideal world, I dare say it's not going to happen before an election, but we were in agreement with the Liberal Democrats on this, that a cross-party commission looking at this would have been a good idea, but that wasn't, that didn't find favour with the other parties.
We now move to Leanne Wood, who is the Leader of Plaid Cymru. Leanne Wood.
Diolch, Llywydd. First Minister, I am slightly concerned that you appear to dismiss research because it looked at just 12 cases. I'm sure that you were well aware of the difference between qualitative and quantitative research, and qualitative research of this nature shouldn't be dismissed. But I want to ask you about your manifesto for the last election, because you promised then that people would be able to access local GP services in the evenings and on Saturday mornings. Why is it then that not one single surgery offering appointments after 6:30 p.m. in 4 health board areas, and there are only 2 surgeries offering appointments on Saturday mornings across the whole of the country? Can you tell us why you failed to meet this election pledge?
Well, if you look at what we've done with GP surgeries, we know there's been an increase in the number of GP surgeries that are open through their core hours. There's been an increase in the number of GP surgeries who have open beyond 6:30, and an increase in the number of surgeries open on weekends. That is something that we want to see improve in the future. They are independent contractors in the sense that we can't order them to do this, but in fairness to a number of surgeries, they're doing it themselves.
2 surgeries are doing it on Saturday mornings, First Minister. You've clearly failed to meet your pledge. Your manifesto said GP services would be available in evenings and Saturday mornings, and the statistics show that that simply hasn't happened. Now, if getting a daytime appointment is difficult enough, an evening and weekend appointment is nigh on impossible, and all too often people end up giving up trying and going to A&E instead, and we all know about the problems with the waiting times in A&E. Do you accept that doctor shortages and nursing shortages are impacting upon patient care, or are you in denial that this is a problem?
Well, if we look at GPs, 82% of GP practices were open for daily core hours, i.e. 8 a.m. to 6:30 p.m. Mondays to Fridays. That is up from, well, you asked the question if you want to have the answer, up from 60% in 2011. 97% of practices offered appointments at any time between 5 p.m. and 6:30 p.m. on at least 2 weekdays. That's up from 2011. 79% of practices offered appointments at any time between 5 p.m. and 6:30 p.m. every day, again up from 62% in 2011. And the percentage of practices closed for a half day for 1 week has fallen from 19% in 2011 to 4% in 2015. We have seen, of course, an increase in the number of GPs in Wales, the highest ever. We have more nurses than ever. And so you know, it has to be acknowledged that we have been recruiting doctors successfully over the past 5 years.
First Minister, the number of GPs went down last year, and the full-time equivalent numbers show that service levels have not gone up. You failed to recognise the impending crisis. Yeah. You failed to prevent it. Now, you said earlier on in answer to the leader of the Conservatives that morale is low amongst junior doctors in England. Well, morale is low amongst doctors here in Wales, First Minister. And you've previously talked about protests outside hospitals in England. Well, we've seen here in Wales your own ministers and your own backbenchers protesting in hospitals against your centralisation plans. Now, First Minister, the Royal College of GPs wants another 400 GPs in Wales by 2020. The BMA wants to see an increase in training places for GPs. Several reports on care provided in your hospitals have recommended more doctors and nurses, and there's the report that we've heard about from the Ombudsman out today. Over the past year, your government has announced an increase in training places for nurses and other health professionals, but you've not increased the number of places for doctors. Now, Plaid Cymru has published detailed proposals to bring an extra 1,000 doctors to the Welsh NHS. I hope you've read our plan by now. You hadn't the last time I questioned you about this. Can you tell us, though, why has there been no increase in the number of training places for doctors in Wales?
Well, I'm confused now, because originally the proposal was it was train 1,000 doctors. Now it's bring 1,000 doctors to Wales. The reality is that if it was so simple, it was as simple as that, then all governments across Europe would be doing it. Doctors come to a health service because they feel that they are able to be innovative, that the hospitals specialise enough, which is something her party have not accepted as something that needs to be done in Welsh hospitals. She talks about GPs. Well, it takes 9 years to train a GP. So what you need to do with GPs is to recruit GPs from other parts of the world. It's a world market. It's naive to think that somehow the market for doctors, if I can put it that way, is just entirely in Wales or the UK. It's worldwide. And people will come to Wales from other parts of the world, as they always have done for the past 50 years. The trick is to make sure that the NHS is seen as a system within which the doctors can prosper, something that is well funded, something that offers a service to patients in that country, and one that isn't under threat of privatisation. And on all 4 counts, we're able to offer that to doctors who wish to come to Wales.
We now move back to questions on the paper, and question 3 is Altaf Hussain.
Thank you, Presiding Officer. Will the First Minister provide an update on how the Welsh Government is supporting the Swansea Bay City deal proposal?
Well, we're committed to securing a city deal for the Swansea Bay region, and we're pressing the UK Government to confirm their support.
First Minister, the city deal proposals are an exciting prospect for the whole Swansea Bay region. There are concerns, however, that the Welsh Government's proposed forced merger of local authorities could impact the proposed deal. How will your government address these concerns?
Those concerns are wholly groundless and certainly concerns we've never heard echoed before. The 4 local authorities in the Swansea Bay City region have submitted their proposal for a city deal to the UK Government. They submitted that proposal on the 24th of February, and the City Region Board is looking to achieve formal recognition of the city deal bid within the UK budget on the 16th of March. The issue of the structure of local government has never come into it.
Mike Hedges.
Thank you, Presiding Officer. The city deal is not a panacea for all our economic ills in Swansea Bay, but I'm sure it will help the local economy. What is being done to ensure that all interested parties are working together in order to ensure that the city deal does occur?
Oh, there's ample evidence for that. Both the the Swansea Bay City Region Board, they've been working together with the local authorities, and the evidence of that is the bid itself. Of course, to get to a position where a bid is submitted requires joint working between a number of different bodies, and now we await the UK Treasury's view of the Swansea Bay City Region bid on the 16th of March. We hope, of course, with regard to that, and indeed the Cardiff City region, that the Treasury will give sufficient commitment to enable the 2 bids to proceed.
Peter Black.
Thank you, Presiding Officer. First Minister, the city deal is very important, of course, for the Swansea City region and will bring tremendous benefits to it. But they can't act in isolation. It needs to work with other government policies as well. Can you say to what extent the city deal fits into other government and priorities for the Swansea City Bay region? In particular, in terms of transport, we'd be looking to extend the metro concept further west into the Swansea City area to tie in the transport links to make the best of that particular initiative.
Yes, that's part of it, clearly. The ability to move easily around the region in order to access employment is clearly important. The city deal proposal that's been put forward will see the city region become a giant test bed, if you like, that innovates and commercialises smart internet-based solutions that will transform the local economy, transform the energy sector and the health sector in the same way as the internet has already transformed the telecoms industry. So it's a very ambitious bid. And inevitably, the transport system within the region will be important, not just for connectivity within the region itself, but beyond.
Keith Davis.
Thank you, Presiding Officer. First Minister, last week, the Joseph Rowntree Foundation published a report which expressed concerns that smaller cities and towns were losing out to the capital within the city region. What can the City Region Board do to ensure that towns such as Llanelli, Bury Port and Kidwelly in my constituency do benefit from the Swansea Bay City region?
Well, it's vital to ensure that the whole region is considered as a region rather than the city of Swansea and other adjacent towns. Llanelli is extremely important, of course, as are the towns and villages around Llanelli itself. And in order to develop the area economically, which ensures that investment comes to every part of that region. Swansea, of course, is the largest city in that area, but that doesn't mean to say that everything has to go to Swansea.
For Ellen Jones.
What are the Welsh Government's priorities for improving public services in Ceredigion?
Well, of course, to ensure that services, that first-class services are delivered in the most efficient and effective way in line with the needs and preferences of the local communities.
First Minister, the Post Office intends to close the Crown Post Office in Aberystwyth, and this will mean that there won't be Crown Post Office services between the M4 corridor and the A55. The community in Aberystwyth and the surrounding area oppose this intention entirely. Would you agree with me that it's important that public services are available within a reasonable distance of travel for all communities in Wales, and that there is a responsibility on the Post Office to ensure that as much as any other public service?
Yes, I do, and I believe that I agree with the member about the Crown Post Office at Aberystwyth. Aberystwyth is extremely important to Mid Wales. It's the largest town in Mid Wales, and it's therefore extremely important that a Crown Post Office exists in the town, because this is something which has affected Barry, and it is very important that towns and that post offices also exist within the rural towns.
First Minister, you'll be aware of long-standing concerns in Cardigan regarding the future delivery of health and social care services in that community. Now, on this forthcoming Thursday, Howell Health Board is running a drop-in event to consult with the local community on plans for the new facility, which will be there not only for the residents of Cardigan and Ceredigion, but also for those in Carmarthenshire and Pembrokeshire. First Minister, given the integral role that the centre will play in delivering a whole range of healthcare packages, do you agree with me that accessibility by public transport for these new facilities is of very great importance? And will you join me in calling upon members of the public in that area to attend the event to voice their concerns about this matter and indeed on other matters pertaining to the new development?
Absolutely. I mean, the development itself is an excellent development for Cardigan. The outline business case was approved in June last year, and the Health Board is now progressing with the full business case, which is currently expected to be received in April. But absolutely crucial, of course, that the public are fully engaged with the proposals as they develop, and transport is obviously an important issue that the Health Board will need to consider.
Question 5, Gwenda Thomas.
Thank you, Presiding Officer. Will the First Minister make a statement on the importance of community pharmacies in Wales?
Yes, we recognise how important community pharmacies are in Wales. We continue to invest in and develop the role of community pharmacies as part of improving primary care, including, of course, our announcement yesterday of over £750,000 to provide better access to patients' records.
Thank you for that, First Minister, and I, for one, agree that Choose Pharmacy is certainly an excellent initiative. First Minister, can you outline what further responsibilities may be transferred to pharmacists to provide patient treatment once they're integrated with GPs and hospitals?
Well, there are great opportunities. Firstly, of course, where pharmacists are able to provide treatment for people, there's then no need for them then, of course, to go to the GP, and we know, of course, of the pressures on GPs. It means, of course, that they can administer flu vaccines, they can run smoking cessation programs, emergency supplies of medicines, review of medicines. These are all issues that in years gone by would have to be done by a GP. But it doesn't need to be done by a GP. Releasing GPs then to deal with more serious cases. Pharmacists now are clinically trained, and this forms part of the Choose Well message that we have that says, go first of all to a pharmacy and then GP practice nurse, GP, and so forth.
Lucy Davis.
First Minister, community pharmacists have been helping patients with the inconvenience of renewing prescriptions for some time by arranging to reorder, collect and sometimes deliver drugs to patients. Will your government reconsider the possibility of allowing community pharmacists to dispense for more than 1 month at a time to patients with certain stable chronic conditions, though we're not talking about wasted drugs at all, on the basis that that would reduce the impact of missed appointments on GP surgeries?
My understanding is that's possible now. that they're able to do that already. Again, releasing time for GPs to deal with more serious issues.
Question 6, Lindsay Biddle.
First Minister, how much money has the Welsh Government invested in attracting Aston Martin to St Athan?
Well, the financial terms, of course, are commercially confidential, but I can tell members that we will be investing in a new road that will be key to providing access to the commercial occupiers at St Athan, and of course we will be working with the company in order to ensure that the building is refitted.
Thank you, First Minister. I understand your reluctance to answer due to the sensitivity, but of course it is taxpayers' money. But could I ask you how many of the 750 highly skilled jobs will go to current workers in Wales? And I emphasise the word current workers because I can accept that certain specialist posts will need to be imported, but I do hope that this will actually create jobs for people here in Wales, please.
Well, of course, that's the idea. It's the same with General Dynamics yesterday in Merthyr. The reason why these companies invest in Wales is not to do with money. As Aston Martin themselves said, they had better financial offers to go elsewhere, and there were 19 sites that were competing against us. They were impressed by what they described as the passion and professionalism of the Welsh Government and the team that brought the investment in. But also, of course, any investor needs to be sure that the skills and the pipeline of skills exists in the local area. If that doesn't exist, they won't come, no matter how much money is available. It was made very clear to me, both by Aston Martin and indeed by General Dynamics yesterday, that they are fully confident that the skills they need exist in the local area, and I'd anticipate the vast majority of jobs going to people locally.
William Graham.
Officer, certainly on this side of the House, we greatly welcome the arrival of Aston Martin and the job that it will bring. I never had an Aston Martin myself. I had preferred the Jensen Interceptor, but there we are. I've answered your questions. First Minister, it's important also that we should, your government should establish a properly private sector-led investment council which can feed back to government the requests of private industry to make more of these new developments successful in Wales.
Well, we do that already, of course, and the evidence of that is shown by the fact we've had record foreign direct investment, the best for 30 years. Aston Martin is one example, General Dynamics is another. There are others in the pipeline. Wales is certainly seen as a place to come now. And what's particularly important is that we are seen as a place where high-skilled, well-paid jobs come. You know, the argument I always had about the policies of the late 80s and 90s, it was this. The jobs were brought here, they were low-paid and unskilled, and they went elsewhere as soon as they had the opportunity, which is why we saw the unemployment rate coming down in the early 90s, but GDP dropping as well, because the jobs weren't that well paid compared to what had gone before in mining and in steel making. And it's something for us all to celebrate, that we are seen as being in the forefront as a country that can attract high-quality investment because of the skills of our people. And it's a tribute to the people of Wales themselves, that they are seen by so many investors around the world as the sort of people who can provide the skills that are needed for those companies to prosper.
Keith Davis? No. Question 7, Bethan Jenkins.
Will the First Minister provide an update on the Welsh Government's involvement in the Rhondda Tunnel project?
Yes, we're currently working with Highways England, just to explain that they manage the tunnel on behalf of the Secretary of State for Transport. They took over what was once described as the burdensome estate of the railways. Now it's the Historical Agency, Highways Agency Historical Railways Estate, but that's where they're involved. We are working with them to establish the legal, financial, safety and environmental liabilities associated with the transfer of ownership, and we are working with them to consider the full implications associated with the asset before any transfer is considered further.
Okay, thank you, First Minister. I'm asking about that really because the members of the society have been concerned that there's been some toing and froing between the Welsh Government and the Highways Department. I think it's the historical part of the department that you would be talking to in terms of that estate. I wonder whether you can tell us, during those discussions, are you minded, therefore, to take over responsibility? Because from talking to the society, other things can fall in place, such as planning permission for other types of access for the area, when that ownership issue has been sorted. I think there's a stumbling block at the moment, and they would like to know timelines from you, First Minister.
The first thing to do is to establish the liabilities. We don't know what they are yet. In the same way as you wouldn't buy a house without having a structural survey. have some idea of what the condition of that building was. So what we're working with Highways England on doing is to understand what the structure of the tunnel is like and what the liabilities, both legal, environmental and structural, might be. Once that's understood, the next stage then will be to consider whether there should be a formal request for transfer. But if you make a formal request for transfer without considering what the liabilities might be, then clearly that creates a potential difficulty further on down the line. It's important that we go into this with our eyes open, and that's why we're working with Highways England in order for those liabilities to be understood.
David Rees.
First Minister, the Welsh Government support for the feasibility study and the BAT survey has been greatly welcomed by all interested in the reopening of that tunnel. However, these are just the first steps in a process which hopefully will see the reconnection between the Avon and the Rhondda valleys, which in itself can be a great attraction for tourists in both valleys and across Wales as a whole. Will the Welsh Government continue to work with the members of the Rhondda Tunnel Society and local members? I acknowledge the comment you make about the liability of the tunnel aspect, but this project can be taken forward to achieve that goal of reconnection and create a world-class attraction for tourists.
We will continue to work with the Society. I know that the work has been, that the Minister, for example, has commissioned Sustrans to provide technical expertise and support to enable the Society to develop a high-level plan in their aspiration of reopening the tunnel and to help the Society to understand the steps that it needs to take in order to move the scheme forward. And that cooperation will continue.
Andrew Archie-Davis.
Thank you, Presiding Officer. First Minister, obviously this was on the order paper, this question, so hopefully you've got a fair bit of brief in there. I think people understand you need to make the assessment of the liabilities. Everyone does understand that. But can you give a time frame for when those assessments will be concluded and the government will be in a position to give some concrete answers to perfectly legitimate questions, because obviously the Trust find themselves unable to bid for grants, etc., without secure knowledge about the ownership and the potential for securing a stake in the tunnel?
Well, we can't give a timescale until we know what the liabilities are, and we understand what Highways England, understand the figure that Highways England give us. Now, because it's a disused railway asset, the tunnel itself has no monetary values. There's no purchase price in that regard, but of course there are bound to be levels of liability. In terms of the transfer, there are a number of implications that need to be considered before we take this further. Highways England consider that there are substantial liability costs, although they haven't yet told us what those costs are. Those costs at the moment are underwritten by the Secretary of State. So if there were to be liabilities, it follows that those costs would then need to be underwritten by Welsh Government. Before we understand what those costs are, we need to have that figure in place. As soon as that figure is available to us, then of course it'll be possible to give, with greater clarity, a timescale for the future of the tunnel.
Question 8, Rena Purewith.
Thank you. Will the First Minister make a statement on mobile phone provision in rural areas?
Well, following an agreement with the United Kingdom government, I know that things are now progressing. The mobile phone operators are planning improvements to the data coverage and voice coverage in Wales by 2017, and of course we want to ensure that that's exactly what happens.
Well, although rural areas such as Ynys Môn pay exactly the same as everyone else in the British Isles for their mobile phone signal, the service is often second-rate, and to be honest, many pay more for mobile phones in areas such as Ynys Môn. Some pay for 2 phones, one for work and one for home. Some pay for a box to boost the signal. Others have to pay roaming charges because the signal from Ireland is stronger than the signal available on Ynys Môn. Now, the Daily Post at present is running a campaign to try and improve mobile signal in North Wales, and they revealed some figures yesterday on 4G coverage. I think the Netherlands 83%, Britain 53%, and Wales on just 20%. Now, given that connectivity is so important in rural areas, what has prevented the Welsh Government from encouraging the mobile phone providers to do more to provide enhanced signal in rural areas and in Ynys Môn?
Well, first of all, I understand the point about Ireland as somebody who has a sister-in-law living in the town of Warren Point in Ireland. Of course, the signal comes from Ireland. That's the strongest one, and therefore, of course, you pay roaming charges because of that. This is not a devolved issue, of course. However, we have been pushing the UK government and also the mobile providers to ensure that people receive the service that they should. If you look at Anglesey, it's flat. You'd imagine that it'd be quite easy to get a signal or coverage to most of the communities on Anglesey itself. Despite that, and this is not right, and as you will know full well, there are some areas where there is a signal, but it's a very weak one. It's not possible to receive data or download the data, or although it's possible to make a phone call. Now that the agreement has been signed by the UK government and also the providers, we now look forward to ensuring that the United Kingdom government ensures that things change for the better in the majority of Wales.
I understand that the mobile network operators have written a joint letter to the Welsh Government urging you to review the planning framework to facilitate the rollout of mobile infrastructure. All mobile network operators have expressed the view that if the necessary mobile infrastructure is to be rolled out across rural Wales, they must be more permitted to do so by local planning authorities through more flexible planning regulation, which will allow an increase in permitted development to a height of 25 metres and allow a 5-metre height in mast height in non-protected areas. I'd be grateful for an update on this and your view on this.
Well, I don't accept the situation is any different, or worse rather, in Wales than it is in England. It's important that the operators learn to share as well. Share masts. I mean, to have a separate mast for every single operator strikes me as being inefficient. In other countries, masts are shared, and I'd urge them certainly to do that. But now we look to see the UK government ensuring that the agreement that they have reached with the operators becomes effective for most people in Wales. It's not just the masts, of course, because one of the issues that's been raised, and I raised it earlier, and I know the member for this morning has raised this as well, it's the strength of the signal. There have been many occasions, I'm sure members will have had experience of this themselves, where the phone may show 4 or 5 bars of phone reception, but you can't download data because the signal doesn't seem to be strong enough. I'm not going to pretend to be an expert on the technical aspects of this, but it isn't simply a question of having masts in place. It's a question of making sure that the strength of the signal coming from the mast is strong enough to make sure, or the bandwidth is strong enough to make sure that people can use the signal for downloading information as well as phoning and texting.
Finally, Kirsty Williams.
First Minister, the mobile infrastructure project was meant to deliver hundreds of masts across the UK to prevent knot spots, but the government in Westminster have scrapped that programme, having just built 40, and having dealt with them and indeed the mobile companies, forgive me if I'm a little bit cynical, that this new agreement will actually make a difference for my constituents in Brecon and Radnorshire. You say this is not a devolved issue, but economic development and public services are devolved issues, and mobile telephony and good signals are crucial to the delivery of both. What steps will the Welsh Government take to ensure that all communities in Wales have access to decent mobile phone coverage?
Well, it's right to say that economic development is devolved, but telecoms are not. There is an obligation on the UK government to make sure that mobile phone coverage improves across the whole of the UK. We expect to see the UK government deliver that by certainly by next year. If that is not delivered, then we'll have to consider what steps to take next.
Thank you, First Minister. We now move to item 2, which is a business.